Well, hello. This is Jenny with Joyful Heart House Calls here in Omaha, and I am going to share a few things with you today about immunity, colds, flu, and that sort of thing. So, really quick video. This won't take long, so feel free to share it all over your pages. This hopefully will help you know what to treat at home and when you need to seek medical advice. So, first thing we're going to talk about is how to subscribe and share. So, there's a subscribe button right under here on YouTube, and if you hit that, then you'll be notified when I post new videos. So, that would be appreciated. And then if you're on Facebook, you can just hit the like and the share button on my Joyful Heart House Calls page, and you will get updates when things come along there as well. So first of all, we're going to talk about a couple of things that are different between a cold and flu virus and a strep or a bacterial infection. So if you have a cold or flu virus, one is typically much worse. The flu is much worse than a cold virus. I often have patients that will call me in the office and say, I physically am too sick to come in. Can you do something for me over the phone? Unfortunately, if it's the flu, there's not a lot that we can do for that. We're going to talk about some immune boosting agents and things you can do. But first of all, you kind of need to be able to differentiate between them. But fatigue, muscle aches, usually really high fevers are associated with flu, terrible headaches, such weakness and fatigue that most normal activities of daily living are nearly impossible. People come in to see me in the clinic sometimes and they say, I think I have the flu, and I'm like, probably not. Just because most people that have the flu are suffering terribly from fatigue and muscle aches. They just literally cannot function well enough to drive to be able to come in. So keep that in mind, that if you are that sick, it may be the flu. If it's a cold or some other cold-like virus, there's hundreds, literally, of strains of different colds. And typically the standard rule of thought is you don't ever get the same strain twice. But there's so many strains that you can actually have similar symptoms. So typically a cold comes with coughing, nasal congestion, sometimes fever, sometimes not, headache, sometimes even sinus pressure will accompany a cold. A little bit of nausea sometimes will accompany a cold because any of this drainage from your head is actually draining down into your throat, bronchial tubes, and stomach. So some of that drainage can trigger a little bit of decreased appetite and some nausea. Typically not a lot of vomiting unless you're a little kid. Lots of small children do have trouble coughing and clearing this crud stuff up. And that's when vomiting will occur. But most older kids and adults don't typically vomit or throw up a lot with a cold bug. Typically, a cold lasts 3 to 5 days at its worst and then begins to clear. So if you're on day 6 or 7 and it's no better, then it may be time to call and get an appointment with your prescriber. Because it may be not a cold. It may be a sinus infection or something else going on. The flu will typically last 7 to 10 days, but again, it depends on variety of the strain, and it also depends on how severe you are sick. Many people that get the flu vaccine often aren't as sick as other people. And then some people just have a stronger immune system and don't get very sick. So there's not a standard rule of thumb that says, oh, it's always this way or it's always that way. That's the hard part. But if you ever think you have a symptom that is worrisome to you, or your child has a worrisome symptom, never hesitate to call your prescriber and get an appointment to be seen. We can do in the clinic tests, swabs to check for strep and or flu, and that way we know Little kids under about 3 or 4 years old are also sometimes tested for RSV, which is a respiratory syncytial virus. It's a really bad viral infection that little bitty kids can get, some as young as a few weeks old. And that virus can be really difficult because we don't have a ton of medicines that treat viruses. So what do you do if you think you have strep versus one of these cold and virus things? Well, you can figure out if you use some of the same criteria we use in healthcare. We use the Centur Criteria, Centor. If you look up and Google the Centur Criteria, it will list several symptoms and ages, and you can decide based on that criteria if you think you need to go in and be seen. The Centur Criteria is specific for strep. So if you have 2 or 3 of the symptoms listed and you fit the age range for the criteria, then it's a high likelihood that you have a strep bacterial infection. Streptococcus is the main bacteria that causes strep infections. If you are not treated adequately for a strep infection, you actually can develop heart problems and kidney problems. So it is never a good idea to wait out a strep infection. That's always worthy of a clinic visit. Urgent care, not necessarily ER, unless you're having really high fevers and or seizure activity from those fevers. So if you have strep, you need to go in and be seen because that's a bacterial infection that requires antibiotics to be able to clear. If you have a viral infection, a cold, a flu, lots of viral exanthems that little kids get, rashes, hand, foot, and mouth, pityriasis, loads of those childhood viral infections, all are viral based and respond decently to symptom management. You treat fever appropriately with Tylenol or ibuprofen products, acetaminophen or ibuprofen products. You can do not ever give children aspirin, use ibuprofen or acetaminophen because of the risk of Reye syndrome. But as far as other symptoms, if there's a cough, you can try an over-the-counter cough suppressant. If there is runny nose, you can try an antihistamine or decongestant, depending on the symptoms. Match the symptoms you have to what the labels say. There are lots of different over-the-counter remedies and things you can try. For the most part, if you're really congested, nasal spray is your best bet. I typically recommend people to use nose spray when they are going to bed, not when you get up, because the gravity is going to help the drainage when you're upright. But if you lay down, it changes the direction of the gravity on the tubes in your head. So the drainage and phlegm has nowhere to go except straight into the back of your head, and it just sits there all night. It doesn't go anywhere. If you use nose spray right before bed, squirt, 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 and then you lay flat, then all night long that nasal spray is running around in these tubes, clearing some of that crud and junk that is building up. And then in the morning when you get up, it has somewhere to go. It's thinner because of the nose spray you used and it worked all night, and it has drainage that will occur because of gravity. The other thing to keep in mind is you have lymph nodes that help drain fluid from your head. So you can massage along here on your child or on yourself. You can massage behind your ears and all the way down. You can tap a little bit on your collarbone right along the clavicle and stimulate these lymph nodes to help drain some of this fluid. You have lymph nodes that come all the way down the back of the neck, and so you can just rub and rub, and that stimulates some of those lymph nodes and helps move some of that fluid around. So usually within 30 minutes or an hour of some of that lymph node massage, a lot of drainage begins to move and can make things a lot more comfortable for you. I'm not a sugar person whatsoever, but I will tell you that severe sore throat pain has been shown to improve with the use of marshmallows or Jell-O. And when I say Jell-O, I mean warm Jell-O, not refrigerated. So what you do is you mix up the Jell-O, just like you would and refrigerate it, only you don't refrigerate it. You serve it warm, just the same as you would prepare it. And so the gelatin tends to coat the throat. I do recommend sugar-free Jell-O. I'm not a sugar person whatsoever, but when you're sick, there are exceptions to all the rules. If there's a lot of congestion, sometimes soda, diet soda, never sugared, can help. That the acid in the soda can help break up the gunk that's draining. And so it's temporary. I do not ever recommend those on a regular basis. So keep that in mind. The best thing by far for most upper respiratory illnesses, and upper is from your throat up, is broth. Garlic broth, red pepper broth, butter broth, all those spices and things mixed into your broth. And you can use vegetable broth, you can use beef broth, chicken broth, bone broth. It doesn't really matter, whatever your preference is. Mix you up some broth, put some butter, some salt, some pepper, red pepper, garlic, onion powder even, and simmer that for just a little bit, and then pour it in a big mug and sip on that. By far, that provides the best relief for most people. Be careful with the red pepper. You don't want to have it so hot you cannot tolerate drinking it. So just a little sprinkle, but the red pepper and the garlic both tend to work in the sinuses and help to open up and clear up some of that drainage and uncomfortable feeling that you get. The last thing we're going to talk about are some of the immune boosting agents. So number one, where is most of our immunity found? In our gut. So if we're getting sick, something is not working right in our intestines, in our digestive tract. And so I typically encourage people that start feeling sick to start on some kind of probiotics. Now, people will say, well, get the most you can get. Well, that's true, but you want to be careful with which kind of most. So what I mean is, if you look at the front of a probiotic label, it'll tell you all these CFU millions and millions. You don't need a high number of that whatsoever. What you do need is turn the bottle around, look at the back of the label, and count how many strains are listed in the chart. The more, the better. So I typically recommend a minimum of 7 to 10 strains, because we don't have just one strain of bacteria in our gut. We have multiple strains of bacteria. And so the more strains you can get, the better. Vitamin D has been shown off and on. It's a little bit of controversy about whether it's really helpful for respiratory things or not. But vitamin D is the base ingredient for all of our hormones and lots of processes. So it's certainly not going to hurt anything to increase the vitamin D when you or your children are sick. Vitamin C is another really good boosting agent. And while some of the airborne emergency, some of those products have some vitamin C, I typically don't recommend most of that. The amount of C and zinc in there are pretty minimal. So I typically recommend using a true vitamin C. Be careful, vitamin C has a natural laxative acting effect on your belly, and so you don't want to take too much too fast. But if you use a buffered kind of vitamin C with either rose hips or quercetin, you can find that the vitamin C is quite calm to the tummy in those cases, and that can be quite helpful. L-carnitine and CoQ10 are two really good supplements to help boost energy. So if you're sick, you're not feeling well, you can increase or add some L-carnitine, which is L-carnitine, C-A-R-N-I-T-I-N-E, or CoQ10. CoQ10 is a natural enzyme made in the liver, and that can help provide energy when you're sick, to the cell, provide energy to the cell when you're sick. Get the right words here. But that can also help you get better faster. The other thing, and the most effective, is elderberry. Now, elderberry is an antiviral. It has been done, studies have been done that show elderberry to be comparable or even better in some studies, depending on which study you're reading, to some of the anti-flu drugs. So If you can't afford the flu drugs, which they get really pricey and some insurances won't cover them, or they're on tier 2 or tier 3, so they're pricey, then you might be one of the people that would be willing to try some elderberry. Do be careful with elderberry. The elderberry syrups are usually alcohol based, so you wouldn't want to dose your children with a whole bunch of elderberry alcohol syrup, okay? So be careful. Read labels and know what you're getting. There are some alcohol-free versions, and so those are safe for your kiddos. They do make capsules and different forms for adults, so you can try different forms. When I first feel a little sore throat or the least little bit of nasal congestion, the first thing I do is grab a couple of my elderberry capsules. And I use different brands. I don't have a specific one that I use all the time. The first year I started using elderberry was about 3 years ago, and I found a brand that I really, really liked, and then of course I told everybody, and then they ran out. So I don't know if it was my fault they sold out, but I couldn't get it by the early spring. By February, they were completely sold out. So now I'm less snobby when it comes to my brands, and so I've tried a couple other brands, and they seem all fine. But as soon as I feel a symptom of a cold or something coming on, I take it that morning and that night. I start twice a day, and I kick it, and I have not had any trouble with any of that. So I hope that's really helpful for y'all. As far as other old wives' tales, honey and lemon are great. The problem is it's honey. It's going to run your glucose up. And for a lot of people that I deal with and help teach or counsel or provide medical care for, have diabetes, and that is not very good. If you don't have any diabetes problems, then you can mix up a couple of different kinds of concoctions, and there's all sorts of recipes you can search online for. But honey and lemon really are very beneficial for lots of this head cold, sore throats, and that kind of thing. Just beware of what you're choosing to use. But don't forget to share and subscribe, that button down there. But thanks for joining me today. I am Jenny Gallagher with Joyful Heart House Calls in Omaha.